Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's August 7th, and we have a lot to talk about. Last week, I told you about a report that was just released in the UK about how data and technology can improve care for people living with MS. Today, we're talking about a company that's doing exactly that. We're talking about MediBio, a mental health technology company that's developed an app that uses biometrics to forecast when someone is heading toward depression. It allows you to proactively head off that feeling of going over the edge of an emotional cliff. And this becomes incredibly important when you're considering the quality of life for people living with MS, because we know that 50% of those people will be diagnosed with clinical depression. And I've said this before, depression makes everything worse, including your most bothersome MS symptoms. My guest today is Peta Slocum, a speaker, author, psychologist, and Senior Vice President of Corporate Health at MediBio. But before we get into my conversation with Peta Slocum, there are a few other things that you should know about. We know that MS is a progressive, debilitating disease. And one of the things that makes MS so difficult to live with is that people living with multiple sclerosis never know which specific symptoms will become their symptoms. They don't know when they might face a relapse or when they might develop additional symptoms. But all MS symptoms are not created equal. Some can interfere with daily living and impact your quality of life more than others. So a research team in Switzerland looked at which MS symptoms were likely to have the greatest impact on the quality of life for people living with both relapsing remitting and progressive MS. Their study analyzed data from the Swiss Multiple Sclerosis Registry, a national patient-centered registry that's been designed to document the epidemiology of MS throughout Switzerland. And within this registry, the researchers looked at 611 participants with relapsing remitting MS and 244 participants with some form of progressive MS. The results of the study indicated that among people living with relapsing remitting MS, gait and balance problems had the biggest impact on their quality of life, along with fatigue, depression, and spasticity. And among people living with progressive MS, weakness, pain, and paralysis were the symptoms that most negatively impacted their quality of life. If you'd like to learn more about this study, I'll include a link to the study results in today's show notes. And since we just talked about the Swiss Multiple Sclerosis Registry, I want to take a minute to tell you about an MS patient registry that you can and should be a part of. It's called iConquer-MS, and iConquer-MS is a patient-centered, ongoing research effort that's governed, driven, and populated by people living with multiple sclerosis. As a participant, you'll take surveys about your daily experiences and symptoms, and you'll share your medical records. Then your information is pooled with similar information from thousands of other people living with MS, and yes, your privacy is protected every step of the way. Research teams can use this collected data to detect patterns that they otherwise wouldn't see, and those patterns among MS patients can lead to improved treatments and better insights into what causes MS, as well as ways to fix it. If you're living with MS today, I'm sure you wish you weren't. And I'm sure you wish that other people might never have to deal with this disease. Well, participating in I Conquer MS lets you get off the sidelines and do more than just wish. It connects you to members of the research community who are committed to solving the riddle of MS. And you don't just have a passive role to play. As a part of I Conquer MS, you can suggest research topics, pose research questions, and even receive research updates on what researchers are learning from all this collected data. If you're ready to fight back against MS, then think about becoming an active participant at I Conquer MS. Sharing your medical information, your feedback, and your ideas is what's going to drive the MS research effort forward. And it's way better to be an active participant in the war against MS than it is to just be its victim. To find out more about I Conquer MS and to sign up, you can visit their website at iconquerms.org, and you'll find a link to that website in today's show notes. As I've mentioned in previous podcast episodes, I try hard to steer clear of politics, unless or until those politics stand in the way of people living with MS having access to quality health care. And that access really begins with being able to find quality and affordable health insurance. Well, this past week, yet another effort was made to make health insurance for people living in the United States with MS or any other pre-existing medical condition harder to find and more expensive to buy. This past week, the Trump administration issued a final rule on short-term, limited-duration insurance. These are much cheaper health insurance policies that cover far less than is required under the Affordable Care Act. They don't cover pre-existing conditions. Some of them don't even cover a hospital stay if you happen to be admitted to a hospital over the weekend. They're full of surprises like that. But if you're young and healthy, well, they have a very attractive price tag. And now, although they're called short-term policies, the Trump administration has lengthened the term from 90 days to 3 years, making them viable, making them even more attractive to a young, healthy potential buyer who doesn't foresee needing health care. Now, you might be thinking that since you aren't going to buy one of these policies, they won't affect you. But they will. And to understand how and why, you just have to remember how insurance works. The insurance system is predicated on the idea of spreading potential risk as widely as possible. In other words, among the greatest number of policyholders. That way, insurance companies can provide the best possible coverage at the lowest possible price. The more people in the risk pool, the lower everyone's costs. So up until last week, everyone, those people who were living with chronic illness and those people who were completely healthy, everyone was in the same risk pool. That way, insurance companies were able to spread their financial risk amongst those policyholders that might have a lot of medical claims and those policyholders who might not have any at all. But now that's about to change because those young, healthy policyholders can move into a far less expensive insurance plan. It covers far less, but they're betting that they're going to stay healthy and won't need a lot of coverage. Of course, anyone listening to this podcast can tell you that everyone's healthy until the moment that they're not. But that's not how these insurance consumers are likely to see things. So they'll move into a different pool, into the so-called short-term pool. And who does that leave in the other insurance pool? A majority of folks who are going to be filing lots of medical claims. And in order to protect themselves and cover this increased financial risk, insurance companies are going to be forced to raise their premium rates. Some insurance companies may simply elect to stop selling insurance in certain areas or states, and that's how all of this is going to impact everyone living with a pre-existing medical condition, and that includes MS. In launching this program, President Trump called it, and I quote, much less expensive health care at a much lower price. He went on to say, and I'm quoting again, we're finally taking care of our people. Well, we're not. We're talking about raising premiums for the people who are in absolutely no position to pay a higher price. We're talking about putting people back into the position of going without healthcare coverage or skipping necessary medical treatment. We're talking about increasing the number of medical-related bankruptcies, and we're talking about people going back to the habit of going to the emergency room for care. And that's been shown to be by far the most expensive way of delivering health care. Several states are already considering laws that will make short-term health insurance illegal to sell. Hopefully, more states will follow their lead. If you're a regular Real Talk MS listener in the United States, this is going to affect you. So I hope you decide it's worth taking action over and contact your state and federal representatives to share your story, share your concern, and urge them to pass legislation that will make short-term health insurance policies illegal and take them off the market completely, because they're bad medicine for everybody. A team at the University of Southern California has developed a smartphone app that's designed to let you manage and track your MS at home. It's called MyMS, and if you've been diagnosed with MS, you're over the age of 18, and you can read and write English, you can sign up to test drive the MyMS app today. Every 3 months, the app is going to ask you to take a couple of surveys that will measure your walking and cognitive functions. The app's going to gather your MRI scans and make those images available on your smartphone. It's also going to collect your genetic information related to your ancestry, personal traits, and various inherited conditions. And it's going to graph all of that data and make it available to you and your healthcare team through an easy-to-navigate dashboard. Through the app, your smartphone becomes a portal into your entire MS profile, and that's the first step toward better personalizing your MS treatment. There's no charge for the app, and there seems to be a lot of benefit. I'll have a link to more information on getting started in today's show notes. I've heard depression described as waking up to discover that you're sitting at the bottom of a really deep hole, and climbing out of that depression can be incredibly challenging. But what if you could take remedial action before you found yourself at the bottom of that deep hole? What if you could take steps to avoid landing in that deep hole to begin with? MediBio is a mental health technology company that's developed game-changing technology to keep you from falling into depression. And in a moment, we'll talk about that technology with my guest, Peter Slocum, the Senior Vice President of Corporate Health at MediBio. We know that clinical depression affects about 50% of the people living with MS. And we also know that depression tends to make other MS symptoms like fatigue and cognition even worse. And unfortunately, depression is frequently overlooked when it comes to MS symptom management, often because it goes undiagnosed. That's why a company founded in Australia called MediBio caught my attention. MediBio describes themselves as a mental health technology company, and they've been doing some amazing work in pioneering the use of biometrics to assist in the screening, diagnosing, monitoring, and management of depression and other mental health conditions. My guest today is Peter Slocum, the Senior Vice President of Corporate Health at MediBio. Peter's a speaker, author, and psychologist. She's credited with creating Australia's biggest mental health check-in, and her focus is on making psychological health more accessible, accurate, and measurable. Welcome to the podcast, Peter.
Thank you very much for having me.
Well, sure. You know, when I just introduced you, I said that MediBio is a mental health technology company, and we don't always see the words mental health technology together like that. So maybe we can start and you can kind of explain what a mental health technology company is.
Sure. So you're absolutely right. Historically, mental health has been something that people equate with, having conversations and going to doctors and having closed-door kind of discussions where people kind of, aha, and then try to sort of create something that might improve symptoms. When we talk about technology, we're automatically implying two things. We're looking at using the best of what we've developed to say, let's actually use technological advancements to improve our treatment, monitoring and management of mental health. And we're also talking about, for the first time, a more quantifiable association between mental health and treatment and outcomes. So just in a nutshell, MediBio has been 23 years looking at research. It's been very much a research, data-driven company based on, very strong and very early evidence that suggests that we can see physiological changes in the body's autonomic nervous system that help us to understand the onset, the cycle and the treatment ultimately that's going to be most useful for mental health.
That's exactly what I was going to ask you about. I know that MediBio has done some really remarkable work in analyzing biometrics as a means of measuring a person's mental health status. Can you explain a little bit about what that actually means and how it works?
Sure. So look, mental health has been literally, it's the land that time forgot. It is the only area of medicine that is still being assessed and approached the same way in the sort of, first part of the 2000s that it is, that it was in literally 1950. So the first thing we need to say is that this is long overdue. I think what we notice is that, before we could actually see the body and measure the body's responses, all we really knew is when we gave people, specific chemicals, when we gave people specific chemicals, like in the 80s when the primary kind of antidepressants were developed, but they seemed to improve their mood. But we actually didn't really delineate between whether somebody was, experiencing low mood because of physical symptoms, low mood because of grief or loss or worry or, clinical depression. So we really only sort of said if somebody's a bit sad, then we will acknowledge that and give them either medication or counselling. What we've increasingly understood is that it's not really about what we call a disorder. It's not about the name or the label that we give it. But we can start to delineate when people's autonomic nervous system is responding in a way that is, not sustainable, so that it starts to operate to a level that has significant, physical and psychological implications. So most people would understand, and particularly MS sufferers, obviously, would understand a lot about the nervous system and autonomic nervous system. What we notice increasingly in people with mental health issues is that there is particular cardiovascular and circadian kind of patterns that accompany low mood. So the first thing we say is that the body starts to actually create stages. It starts to pull itself into a bit of a fight or flight response to manage stress, and then we're not designed for that. So what happens is we then start to get a breakdown in, resilience and mood and clear thinking versus foggy thinking and motivation levels and diet and appetite and libido and all of those sorts of things that we've really known for hundreds of years are related to, are a link between mental health and physiology.
I read an interview with Olympic swimming champion Michael Phelps, and he was talking about a personal mental health app that MediBio created for the Apple Watch. Can you tell us a little about that?
Sure. So this is really where the technology becomes able to be put into a specific product. What we are aiming to do, or what we have been able to launch in MediBio's, and MediBio is a game-changing way of looking at mental health. The app itself is I guess, the way we intersect with the with the individual consumer. At the moment, my purview, the area of the organisation that I'm responsible for, we have had this commercialised in organisational mental health for quite some time, and that could, for argument's sake, be, MS sufferers or groups of people where we want to be able to collect, data. For example, in Australia, we have been tracking this product, with the app, been tracking medical students cohorts over time to have a look at where the level of distress and burnout and things, comes in. We've also done this with some of the largest suicide populations in professional groups such as, veterinary surgeons. So the app enables people to do two things. First, when you download it, it asks a series of questions that are traditionally associated with the assessment of mental health, but they also add to that then the ability to answer the questions and get a really detailed, immediate report back that says to the individual, here's where you're at currently in terms of, depression, anxiety and stress. Here's where you're at currently in relation to factors that we would often see emerge before there's a mental health issue, such as self-awareness and sleep quality and resilience. And then we look at other personality factors that create risk. It also then allows you to connect a biometric, so a Fitbit or an Apple or a Garmin watch, any device with heart rate sensors, and certainly all the current ones have that level of data integrity, and that tracks literally a daily biometric. So it gives a daily score back, almost as to, I think if we were putting it in simple terms, John, how sort of how aroused or how active the body's autonomic function is, and whether or not those biomarkers are indicating that, people are starting to head down the path of having a poor mental health or a mental health diagnosis.
That just sounds brilliant. And the fact that it leverages the wearable technology that people are already adopting makes it so accessible. That sounds terrific.
And so when it comes to what does this actually mean, for example, in the, pre-Medibio, how mental health and MS may intersect versus, post-Medibio's work. Before Medibio, the traditional approaches, and as a psychologist, I see this a lot with people with, MS, chronic pain, epilepsy, a range of other, issues, or people who are in rehab after a, accident or injury. Beforehand, what we would typically find is that people would go through their normal kind of diagnostic path with their physical issues. So again, for example, MS, they would then be given maybe some general resources on, mood and self-care and those sorts of things. And then effectively they would be on their own with the ups and downs of the psychological journey until at some point in time, be it becoming fearful or upset or very distressed or losing motivation or not engaging in, treatment compliance or being compliant with medication. People would say, they're depressed, we've got a problem. So they would effectively go just the day-to-day medical management, and then at some point it might become undeniably flagged that they have depression, and at that point people will say, okay, do you want to see a psychologist, or maybe we should add an antidepressant or an anti-anxiolytic to the medication. Post-Medibio, what that looks like is that the family, the friends, the carers, the people with suffering with physical health conditions as well, every single day and every single week, what they can do is they can start to track. So they and or their treating physicians and or their carers can literally see an overlaid score or graph day by day and week by week and year by year, if they just happen to wear a device on a daily basis, we can start to see the very, very early signs that people are moving into unhelpful levels. And we can give them a specific program to manage that on a daily basis. And it's confidential and it's private. They can share it with a carer. And when they attend a treating physician or they sort of have their standard appointment update, the physician, instead of saying, look, how have you been managing and, having a symptom discussion and or look at how you're coping in general, they can use this data. They can automatically have a pattern overlay over time of mood and how it intersects with symptoms and or the patient's quality of life. So the doctor's no longer and the patient's no longer just waiting until, as I said, it becomes kind of unavoidable that mood is an issue. They can see this stuff emerging and we can actually kind of auto-correct, rather than waiting until we're way off course.
Wow, that is just brilliant, where you can proactively see how your emotional equilibrium is trending. If you are headed in a negative direction, you actually can see it charted out before you fall off the edge of the cliff.
Absolutely, and you would have probably heard Michael Phelps talk about, we've got a video on our website of Michael talking about the fact that the device started to enable him to see this, weeks ahead of time, so then he could sort of manage that rather than again wait until he, they ruled out, a whole lot of other issues before they said, look, it must be mood. As a treating, psychologist, the issue of mood, we do so much to try and improve people's quality of life and symptom management. And yet, the reality is that if people are feeling flat or sad, or starting to get a bit dark, their symptoms could improve a little. But, if you're not feeling like getting out of bed and you're sort of more inclined to start feeling that flatness, all of the things that we work for to improve quality of life are sort of sabotaged or undermined by the psychological impacts.
Well, you mentioned your website, and I was about to ask, where can our listeners find out more about what MediBio is doing?
Yeah, great. So the website is effectively, they can just search MediBio, or it's medibio.com.au. There's some videos and some specific areas there. The Chief Medical Officer is an absolutely brilliant medical practitioner himself, and very committed to looking at individual use cases and algorithms. I'm certainly more than happy, through the inquiries page to answer any questions or to direct people, as a treating team on the ground as to some of the ways this can work.
I just think that the work that MediBio is doing is so important. It's going to empower people to better manage their own mental health. It's going to help in diagnosing depression, which will lead to earlier treatment. And that's going to lead to a better quality of life for so many people who are living with MS and depression, and millions more who aren't living with MS but who are battling depression. Well, Peter, thank you again for taking the time to talk with us today.
Thank you for your belief and support in this. It makes a big difference, and it's treatable, and we just need to make it as easy as possible for people.
I think thanks to the work you guys are doing, we're a step closer to that. So thanks again for taking the time to talk with us today.
Thank you. Thanks, Josh.
Before we wrap things up, I'd like to say thank you to everyone who sent me an email or messaged me on Twitter with suggestions or ideas about what you'd like to hear in future episodes of Real Talk MS. If you have any feedback that you'd like to share, you can email me at john@realtalkms.com, and that's JON@realtalkms.com. Or if it's easier, you can go to our website at realtalkms.com and fill out the form on the Contact Us page. Your suggestions and feedback are important to me, and they're always welcome, so I hope you'll get in touch. My name is John Strum. Thanks for listening, and we'll catch you next time.